नमस्कार, मैं डॉक्टर विनीता। मैं मास्टर्स इन ऑर्थो फिजियोथेरेपी हूँ और हमारा आज का टॉपिक है इलियोटिबियल बैंड फ्रिक्शन सिंड्रोम। सो इलियोटिबियल बैंड फ्रिक्शन सिंड्रोम is a repetitive activity, can also lead to irritation of the soft tissue, such as iliotibial band friction syndrome, which is common in runners. So who are athletes or they having activities such as bending knee again and again, and they are doing running, squatting. So in such conditions there is a problem called iliotibial band friction syndrome. How it develop, how it occur, and why it occur. So we will learn all this in this video. So it's a repetitive bending and straightening of the knee over a long period of time, such as in cyclists, long distance runner. The friction from fascia gliding over the lateral femoral condyle irritate and inflame the distal insertion of the IT band fascia. Can also develop in fast growing adolescents. So this may be happened in the athletes, cyclists who are doing running, and people who just going for a rigorous cycling on weekends or other. So it may be occur in these patients. So how to examine? Your main purpose is to examine the patient. So patient typically complain a gradual onset of pain. So pain increase gradually, there is tightness, there is burning sensation, lateral aspect of the knee that develop during the course of a run. He will start running and he feel pain. That pain he feel gradually, like day by day it will increase, and there may be tightness and burning sensation too. So symptoms usually resolve with rest. Patient complain that whenever I'm going for running or whenever I'm going for cycling, that time I'm feeling pain, but after that I'm feeling good. So examination reveal tenderness and possibly localized swelling at the lateral femoral epicondyle or at the Grady's tubercle. So this is your homework to find out the Grady tubercle. So it is around the knee joint, so you have to find out it, and you just type in the comment section. When the knee is put through the range of motion, pain, snapping, popping, and there is a crepitation may be felt as the iliotibial band across the epicondyle. How you feel that? Just you have to put your fingers, and what you do, you just close your eyes and ask patient to move, and you feel the crepitation sound, you feel the popping, snapping sound. And if there is swelling, what you do, you do the observation by just assessing the other knee and the temperature. So you have to do that. So the presence of symptoms we can found easily. Other factor which can lead to development is the abnormal mechanism, the posture of that patient or of that athlete. Poor hip muscle strength, decreased flexibility, worn out shoes, or uneven surface training. So yes, people are who are doing training, they don't have even surfaces sometime, and there are some condition where they can't change the shoes regularly and they face such problems. So what you have to do, you have to analyze each and every aspect so that you can treat the condition and it will not reoccur, because reoccurrence of the same disease is much more difficult for the patient rather than the main condition. Okay, so what are the predisposing factors that predispose runner to iliotibial band friction syndrome include like a recent increase in distance or running on a track, like which I just explained. So these are the main things you have to find out. Then we go to the differential diagnosis. So if there is a IT band syndrome, like person is facing IT band frictional syndrome. What are the other tests you have to just diagnose na? So other disease also you have to just differentiate. Ober test can indicate IT band tightness. Pain increase likelihood that patient has ITBS, and MRI can aid in diagnosis. So these are some tests you can find out in only in IT band syndrome condition. So what is the Ober test? In Ober test, patient position in sideline, patient hip is extended, abducted, and patient's knee flexed. Okay, you see in the picture, cliche allow proximal part of the leg to drop passively onto the contralateral limb. Consider positive when the ipsilateral leg fails to lower. So when you are doing lowering down it or you are doing it down, that time patient feel pain. So it will irritate because we are doing the same movement which they feel pain. Then the part of iliotibial functional syndrome in runners rehabilitation. What you will do in rehabilitation? So it's a main protocol. What you have to do. There is two-man overstretch. So what you do? Patient in prone line, and you have to stretch the leg. Okay, one person hold the leg and other person just hold the hip joint posteriorly. So it will help the patient to feel stretch only on that muscle. Self overstretch, what the patient does in the sideline, and they will flex the knee with the other hand and they stretch. Lateral facial stretch, what they will do, cross the legs and do side stretching. Posterior facial stretch plus gluteus maximum piriformis self stretch. Just hold the standing wall, lean on lateral facial stretch. These are some stretches which I will mention in this video in the last in a picturized form so that you can understand it easily. So this patient education, activity modification, these are very necessary things. Initial treatment should include heat, cryotherapy, decrease inflammation, because heat not give heat here, sorry for the misprint, only give cryotherapy. IT band massage, stretching affected limb, and strengthening. After some time you do strengthening after the condition is treated. What are the, like, majority of the patient will respond positively to conservative treatment. The few who do not will require surgical intervention. In surgical intervention, what they do, they will do steroid injection into the bursa. So yes, it will help the patient if the condition is much more worse. So this is all about the frictional syndrome in runners. What we can do another session where we will do another topic. So if you have difficulty in any topic, you can type, or otherwise I will take a topic. Thank you so much.